presentation begins. We appreciate everyone being here. And it's nice to see people that I know came to the distributions over this last week.
Okay.
So thank you. All right. I'm sure more people will be joining us, but we're going to go ahead and get started because I value all of your time, especially our expert here today. This is a series of virtual little Zoom things that we've been doing all week long. This is our fourth one, and today we're going to be talking about infection prevention and COVID-19. If you missed our previous sessions, they are all up on our website, and you can go to healthyagingassociation.org to rewatch any of those sessions that we got to do this week. So this is part of our Healthy Aging and Fall Prevention Summit, and I would like to introduce our guest expert with us today, Dr. Robert McGrew, who will be joining us, and I will just be sharing just information prior to handing it all over to him today. And he'll do a better introduction of himself as we get closer to his slides. This session is being recorded. If you feel uncomfortable, please feel free to turn off your video. The recording will be posted on our website and our social media pages. All participants will be muted for the duration of the session, except at the end to answer any questions you might have. This event would not be made possible without some pretty awesome people. We have our presenting partner, Kaiser Permanente, and the Stanislaus County Area Agency on Aging, our super sponsor, E&J Gallo Winery, and two other major sponsors, Alignment Health Plan and Independence at Home, a scan community service. Some additional sponsors I'd like to mention, Central Valley PACE, MID, Stanislaus Regional Transit Authority, Sutter Health Memorial Medical Center, and Sutter Gold Medical Foundation. Some of our Sapphire sponsors, Caregiver to You, Catholic Charities, Central Valley Hearing Aid Healthcare, Community Hospice, Health Plan of San Joaquin, Move Stanislaus, Oak Valley Community Bank, PMZ Real Estate, Senior Outreach Oakdale, Siva Hospice, TID, and Visiting Angels. So we had event bag distributions happening all week long. There's the big, beautiful bags that we had, some amazing volunteers who helped us out, and some attendees who actually received the bags this week as well. I hope you all were able to pick up a bag this week, either in Ceres, Newman, Grayson, Patterson, Modesto, Oakdale, or Riverbank. Today's agenda, we started with some introductions. I'm going to go over and review and recap some of the videos and handouts that were posted on our Facebook and website throughout today. Then we'll talk about some takeaways from the videos and some additional information, services and resources available here in Stanislaus County, and then we're going to open up for questions and answers. At any time throughout today's session, if you have any questions, please feel free to utilize the chat box and send all questions to me, and I will ask our expert, Dr. Bob, at the end, as many questions as we can for today's session. So like I mentioned, today we're talking about infection prevention and COVID-19. So we're going to be expanding on the 5 links. Over here on the right side of the screen, you can see what it looks like on our website. So we have those 5 links and handouts that can help prevent infections and stay safe. And all of these resources were provided by Kaiser Permanente. These links and handouts were shared throughout the day on our social media and can be found by visiting our website at healthyagingassociation.org. And all of these handouts were also placed into your event bag. So if you just open up your event bag a little bit more and go through some of those handouts that were in there, you will see these handouts available in there as well. One handout that was also included, it talks about taking care of yourself, your whole self, to stay healthy. And this is all around every part of your body. So we're talking about good skincare, oral health, exercise, healthy diet, staying hydrated, and getting vaccinated. Today, we're going to be focusing on that last little bullet there, getting vaccinated. So I'm going to pass it over to our guest expert today, Dr. Robert McGrew.
Thank you very much, Samantha. I see some familiar faces, and I thank you for coming, and I hope that I can give you some information that's helpful for you, but also that you can talk about friends and family also with information about influenza and COVID-19. I just want to highlight today a few things that not even all nurses and doctors really know, but now you will. And I think it will help make decisions about what you should do to, what decisions you should make going into the holiday period and the winter period when we see more infections, okay? So let's go to the first slide. And to start with talking about prevention of influenza and COVID-19, I think we need to consider two important questions, which are kind of on opposite ends of a spectrum of freedom versus the community interest, personal freedom versus community interests. So the first question is, what is my responsibility for protecting myself and my loved ones from dangerous infections? For most of us, we want to protect our loved ones from injuries, from infections, any way that we can help them. And that's often a highly motivating factor for many of us. But also, what about responsibility for those I come in contact with who are outside of my inner circle of friends and family? And this is the community at large, and sometimes the interests of the community at large intersect or maybe impinge on our personal freedom. And we can kind of keep that in mind. And what do I mean? Well, say you're a young person, say you're a young family, you've got 6, 7-year-old kids, 8-year-old, 9-year-old kids, and you've got, your kids are over 5 and you're in your 40s, maybe 30s, and you're in great health, not overweight, no diabetes, nobody has autoimmune illnesses. For you, you may want badly for schools to be in session, for everything to be opened up, not to wear a mask, because you're very unlikely, a family is very unlikely to have serious COVID or serious influenza for that matter. But what about the grandparents? What about the older neighbors? They may have an interest in having you not pass COVID to them. So this has been a dialogue we have had for a long time. So let's go to the next slide. COVID and influenza. Now I'm talking about influenza. This is true flu, not a common cold type, cough and runny nose, mild fever. This is a really bad, usually bad infection. All of us have had it at some extent where we've been just knocked in bed for a week with a high fever, severe headaches and muscle aches, sore throat, really bad cough. Maybe we got through it well, but we really wouldn't want to have that again. That's what we're talking about with true influenza. Of course, COVID can cause very similar symptoms, and both are highly infectious to close contacts of the ill person. Next slide. So the difference is that COVID-19 causes much more serious disability and death compared to influenza. And last year, the estimate is around 35,000 people died of influenza-related reasons, and 100,000 to a couple 100,000 people were in the hospital with influenza, mostly again elderly people, but some of them were under 5 and a few people in the middle. COVID-19, of course, was 350,000 plus people who died last year of COVID. So an order of magnitude more people, and hundreds of thousands of people were in the hospital. So when influenza, the key difference is the virus just grows in your nasal tract, throat, trachea, all the way down to the bronchial tubes, but it just stays in that area. It doesn't go in any other tissues. And again, pneumonia is often not just the virus causing pneumonia, it's a secondary bacterial infection. Comes into the damaged bronchial tubes, get a bacterial infection, land in the hospital, and often for particularly older people, people can pass away before antibiotics can work because they're just so sick from the flu virus. But let's go on and see about the COVID-19 virus. Okay, now here's what a lot of people don't understand. COVID-19 virus reproduction is not just in the nose, throat, windpipe, and trachea, bronchial tubes, not just in the lining of your respiratory system. Serious pneumonia and death is usually due to the damage caused by the virus, not by secondary bacterial infections, and antibiotics don't work. Now, we do have some new antiviral agents for COVID that show some promise, but you're still much better off not having bad enough disease to land in the hospital, particularly if you're over 65 or you have an immune system issue. And then in addition to that direct insult from the virus in the lungs, which often causes scar tissue and chronic lung issues ever after in our people who are bad enough to be hospitalized, but fortunate enough not to die. You also have the cytokine storm, which is your immune system going wild, and there's a lot of collateral damage that happens with COVID, much more than influenza. Blood clotting. It actually, the COVID virus affects the lining of blood vessels, creates blood clotting. That's actually a cause of many strokes in COVID infections, and pulmonary emboli, which are blood clots that come up and land in your lungs. In fact, just unfortunately, just Saturday, we are going to a memorial for a 44-year-old woman who died of COVID last month. As kids, good job. And one of the things she presented with before she went to the hospital was the pulmonary emboli, the clot that started in her legs and went to her lungs. And then other reasons for severe disability after COVID and death include the fact that it grows in not just blood vessels, not just the lungs, but heart muscle, kidneys. There's a lot of kidney damage after COVID, nerves and brain. So when you lose your sense of smell, it's actually an infection of the olfactory nerve. It's not just your nose is so congested like happens in colds and flu. It's actually an infection of the nerve, which is pretty scary. Okay, let's go on to the next slide. And then treatment. A lot of people, say, well, why should I get a vaccination? Because, I can be treated for flu. And there are some antivirals that work fairly well if you start them for influenza in the first day. They can cut down how long you're sick and maybe help you not to get sick enough to be in the hospital. On average, if you take the anti-flu medication in the first 24 hours you're sick, and it's very hard to get the medicine by then because it's prescription, then you'll be sick one less day. So instead of 7 days, it'll be 6. Instead of 10, it'll be 9, that kind of thing. So many people still still spend a miserable week at home, coughing, feeling achy, bad headaches, really lousy, even with the fact that we have medications. As I said, hundreds of thousands are hospitalized in a typical flu year. And last year was a very mild flu year because the masks help reduce influenza. And, as we said, 30,000, a bad season is over 70,000 deaths here in America, mostly over 65. So let's go on to the next, which is on COVID treatment. And again, we certainly have some emerging therapies to help keep you out of the hospital if you get them early enough, both antibody infusions, which are difficult to access and limited, and some new pills coming out to take early on for COVID. But despite the increasing despite their availability, we're still seeing a lot of people hospitalized with COVID, a lot of people dying, and they're mostly unvaccinated people right now. Since 2020, as we know, 700,000 or more Americans have died from COVID. But what we probably don't realize is that triple or quadruple that number are home from the hospital over the last year and a half, but still have lingering symptoms, whether it's kidney damage, lung damage, severe fatigue, and this kind of thing. And next slide. So do physical measures work? Well, for 40 years as a family doctor, I've worn a mask when I'm assisting at surgery. And I've assisted a couple thousand surgery assists doing operating room surgeries with my patients, and worn a mask every time. And that's to protect the patient so that I don't cough or sneeze, and the germs don't get into the operative field, or even to protect the people around me. We're all huddled, looking. We're close together doing that surgery, and it makes sense, I think, to wear a good surgical mask. It turns out the masks referring to surgical masks worn properly over the nose and throat that are tight protect others more than they protect you, the mask wearer. So if everyone wears masks, we're protecting each other. If I'm wearing a mask and no one else is, then I have some protection from the mask in terms of getting COVID, in terms of transmitting it to my wife or someone else. But it's much better if other people are wearing the mask. Does that make sense? So besides mask, it turns out it's just as important to be 3 feet or more away inside, to have good airflow, and if you can, to have very good air filters that are changed regularly. HEPA level air filters are very expensive. Most of us don't have them in our houses or offices, but the airlines do have them, and they are helping reduce transmission at airlines. And then isolation of infected people till they're not infectious. And the numbers are, it takes up to 10 days where most people are not infectious after symptoms have started for COVID. And people who are elderly or immune suppressed, it may be a month that they can transmit the virus. So without isolation at school or work, again, the virus just spreads more eagerly through the community. So let's go to the next slide. So influenza vaccine, and this is the vaccine that I've had the most people, and often they're older people, telling me, Doc, I don't want the flu vaccine. The last time I got the flu vaccine, I got the flu right after. And I don't know how many times I've heard that. But of course, the problem is that in English, in America, we call everything flu. If you're throwing up and have diarrhea, you have the stomach flu. That's what we often refer to it. If I have an ache and a pain and I'm sneezing a lot and coughing a little bit and feel bad for a couple of days, I had, quote, the flu. But as we just said, influenza is really usually a very serious respiratory infection. Often the fever's high, often you're lying in bed for between 3 or 4 days up to 10 days. And again, just feel miserable, feel worn out. It's really bad. Anything else is very likely not influenza. And that's the big area of concern I have, talking about vaccinations, that people misunderstand what we're vaccinating for. And then another issue for influenza vaccine, which is a little bit more pronounced for this vaccine than for COVID, is the fact that every year there's announcements about how effective the flu vaccine was this year. And it's difficult to make 100% flu vaccine, one that totally stops any infections, because the RNA viruses, influenza and COVID are both RNA viruses. They change their genetic code so frequently that it affects how well the vaccines can work. So last year, they may have said it's 20 or 30% effective for the vaccine last year, the mix of antigens in the vaccine were about 20 to 30% effective in stopping influenza. And you may have said, well, it's not worth getting the flu shot next year for, 20, 30%, I don't need an immunization. But the key thing to remember is there is far greater reduction in hospitalizations and deaths, because when we say that it just reduced infections by 30%, we're talking about any infection, even a mild infection, even an infection that keeps you home for a few days and isn't too bad. That's still counted as an infection. So you get much less likely to have severe infections, hospitalizations, and death with influenza vaccine. I'll be happy to take questions in just a second about this. But for those of us that are older, those of us that have issues, pregnant women, small children under 5, especially for influenza, and pregnant women for both influenza and COVID, people with immune system issues, people over 80. People over 80 just don't make antibodies as well, even if you're well vaccinated. It's important to consider vaccinations and other measures to prevent you from getting infected. So let's go to the last slide. So COVID vaccination works very well. And a lot of people are still questioning, well, maybe there's going to be serious side effects. It's only been out 11 months. Shouldn't I wait longer before I take it? But of course, in the last 11 months, we've had 300,000 to 400,000 people die of COVID. And we haven't proven, we've had only a handful of deaths and in the hundreds of serious side effects from the vaccines versus hundreds of thousands of deaths and literally 1 million people in the hospital with COVID. I mean, a huge toll. So right now in the hospitals are much more likely to be unvaccinated people than vaccinated people, despite the fact that the majority of adults in America have had at least one vaccine. And the large majority of deaths right now are from unvaccinated people. So I think that should convince us, even if we're skeptical previously. The vaccine does reduce asymptomatic infection, so you're less likely to get the COVID virus in your throat, where you can give it to somebody else, even though you feel okay. And it doesn't, if you get an infection, it doesn't stay as long. So you tend to keep the germ less long, whether you have asymptomatic infection or symptomatic infection. Both of those contribute to less transmission of COVID if you've been vaccinated. And, we all desperately want normalcy. Throw away the masks, go back to doing everything the way we did before, including having our health summit at the Modesto Center Plaza and being able to mix with hundreds of other people. And we look forward to that next year, but our best hope for safely doing that is to be well vaccinated. So I'll leave you with that thought, and let's go to any questions.
Any questions? I have none in my chat, but does anyone who is joining us today have any questions for our guest expert, Dr. Bob? Don't be shy.
I appreciate everyone listening. And I know it's been a subject that's been lots of information is available, but I hopefully maybe learn one or two more things.
Yes, I have a question.
Yes.
I was wondering, since I got a shot back in August, I had the vaccine shot on the J&J. Will I be able to get a booster when they're approved?
Yes, good question. And the answer is yes. you only have to have, for the J&J, they're saying to get a booster 2 months or more after you had the first shot.
Okay.
And so if you had it in August, that would be sometime in October, would be 2 months after. So you will be able to get the booster. For the other shots, the Moderna and Pfizer, as most people realize, you had 2 shots initially, and this third shot was 6 months or after you had your second shot of Pfizer or Moderna. That's been the guidance.
Okay.
Okay, Naomi?
Thank you.
Yeah, so yes, hopefully you can get that soon. And great news on the Johnson & Johnson. After the second shot, the protection against infection, which is means that you get sick at all from COVID, jumps from 55% to 94% the month after. So yeah, that's very good.
Yeah. Okay. Well,
And
thank you.
even better protection against hospitalization and death.
So, should you get the same one or a different one?
Yeah.
Oh, okay, good question. So you're right. They're just guidance. Just yesterday, you're right up on the information. Just yesterday, there was a recommendation, and I'm not sure if it's been adopted by the CDC yet, but it was a recommendation from their expert panel that you were going to be allowed to mix and match, that they were going to show a preference. So for instance, if you got the J&J vaccine, you could get a Moderna or a Pfizer vaccine, which are different types of vaccine than the J&J. The best evidence for mixing and matching is exactly that scenario. You got the J&J, which is called an adenovirus vaccine, and then you get the Moderna or Pfizer, which are called mRNA vaccines. They're 2 different kind of ways of getting the immune system target into your body. And they work a little differently, but it turns out that there's been very good evidence in other parts of the world that you can mix and match a vaccine like J&J that uses the adenovirus with the Pfizer or Moderna vaccine and get very good antibodies, better than after 2 of the same. Now, with regard to Moderna and Pfizer, there's no good evidence that it makes any difference, whether you take J&J or whether you take Moderna or Pfizer. So the guidance is still to get the same one if possible, because we have the best evidence that does provide very good booster. Okay.
And Emmy, did you have a question?
It was already answered with yes, thank you.
Perfect.
Oh,
Perfect.
good, Emmy. Okay, good. Glad I could answer it.
Any other questions?
Well, I know it's a complex topic, and I realize some of the things I said may not have made a lot of sense because it involves quite an understanding of the immune system and how germs are passed. But appreciate people coming, and hopefully you can help encourage other people to protect not only your family but the whole community.
And thank
hopefully,
you.
Hopefully we'll be doing this next year at the Center Plaza.
Yes, yes. And I did see some of you at the vaccine clinic yesterday that we had over at the Stanislaus
great.
Veterans Center. I know I briefly saw George in there and a couple others on here. So we appreciate you guys coming out to either picking up your bag or participate in this event at some capacity and being here today. And thank you so much, Dr. Bob, for being here and sharing your expertise with us.
Of course.
All right, well, I hope you all have a wonderful Thursday, and we'll be back here same time tomorrow talking about stroke education and life care planning. So I hope you'll join us for our last and final session of the week. Thank you, everyone.
Okay, bye. Bye, Samantha. Thank you, Samantha. See you tomorrow.
Bye.